We have a voicemail number. That number is 2192 David P. Here's a voicemail question that is an interesting one, and we haven't really addressed this much, so let's take a listen.
Hey, David, a skeptical human here. I wanted to get your take on the idea of the means testing of social benefits, whether we're talking about Social Security, free college, Medicare for all. And by means testing, of course, I mean this idea that wealthy people, since they can afford things like college for themselves or healthcare for themselves, it shouldn't be provided to them through the taxpayer-funded pool of money. Thanks, and keep up the good work. Bye.
So I understand the instinct here, right? Which is, if you're a billionaire, do you need $1,700 a month in Social Security benefits, for example? Not really. It makes no difference to you. So I understand saying, what if we start means testing some of these programs where if your wealth or income exceeds some threshold, you don't get it? I don't think this is a good idea. Okay. First of all, if you've contributed, it's not super clear to me how you say that you're not eligible. That's number one. I don't understand how you can really do that. But what's more important to me as an argument against means testing these types of programs is that the bureaucracy needed to do the means testing means that you have a means testing apparatus, which costs money. And this is part of what drives up the cost of many of the programs that we want to try to reduce the cost of. So healthcare is a great example. A lot of what makes it so that the healthcare system we have costs what it does to run and costs what it does for the end users, the consumers of healthcare services, is this massive apparatus that exists around for many of the state-funded public option type programs. You have to means test those. For the hospitals, the medical billing apparatus. Bureaucracy costs money. What we're trying to do is limit that in order to reduce cost. The other reason I wouldn't start doing means testing for these programs is that you create stigma around claiming the benefits, okay? If you have too much money and you don't qualify, it starts to imply that by receiving a social benefit, you're sort of branding yourself in a particular way, which people may not really want to do, for better or worse. That could be something we say, it shouldn't be that way, but it is. There is stigma around some of these programs. So what you end up doing really is increasing the cost of the programs and diverting money away from the money that could actually go to people by having these means testing apparatus. And when you means test, it's known to hurt those in the middle, because when there's a cutoff point, people on the sort of borderline will start to make financial decisions in order not to start losing benefits by going above what those limits are. It creates this gaming mentality, the stigma component. So I'm against it. I understand morally the reason why many people would look at that. I don't think it's a good idea. I don't think it's something that the left should run on. If you disagree, let me know. We've got a great bonus show for you today, 3 great stories and more. davidpakman.com/membership, patreon.com/davidpakmanshow to get instant access to the bonus show.